Hello, I'm Dr. Alan K. Smith, founder and audiologist at Anderson Audiology Consultants, and I want to talk a little bit today about hearing tests. I know there's a bit of trepidation. People are always nervous when they come in for a hearing test, so I just want to talk a little bit about what occurs during a hearing test. Typically, after you've filled out the paperwork, we bring you back, I come in, and we talk about your history. What types of difficulty you're having, what your family has said about your hearing. We review your medication list. We talk about different situations you might have been in that might have damaged your hearing, such as noise exposure. Is there a family history? Questions that are basic history questions. I'm going to take a look in your ears. We're going to make sure that there's no debris or any wax that could be interfering. Also make sure that there's no sign of any infection in the ear canal and that the eardrum is intact. If you do have wax or cerumen, any type of occlusion in the ear, we're going to go ahead and remove that prior to the testing. The one thing I tell everybody is when we're removing debris from the ear canal, we really take our time. And if you just slow down a bit, it's usually a lot more comfortable than just going in there and kind of being a little bit more aggressive. Once we have cleaned the ear out if we need to, or we've identified that the ear is clear, we're going to bring into the test booth. We're going to run a test that's called an impedance test or a tympanometric test. Basically, we're just looking at the middle ear function. So from the eardrum to the start of the beginning of the inner ear, we're going to look at the eustachian tube function, basically by just pushing and pulling on the eardrum with a little bit of positive and negative air pressure. It's completely harmless. It takes about 3 to 5 seconds per ear to run that. But that indicates to us whether or not somebody has fluid, making sure the eardrum's intact, making sure that the eustachian tube is functioning the way that it's supposed to. Then we're going to use an insert headphone. We're going to listen to pure tones, these little small beeps that people hear in their ear. When we present the tone, you're going to go ahead and push the button for us to let us know that you heard it. That takes about 15 to 20 minutes. We're going to do some word lists where we have you repeat words to us. We might do them in quiet. There might be some competing noise. There might even be people talking in the background. The last part of the test is what we do, what we call bone conduction testing. We're basically going to take an oscillator and put it behind the ear on the mastoid, and we're going to have you listen for the tones again and just push the button when you hear the tone. The whole test battery typically takes about 20 to 30 minutes, depending on what we're finding during the testing. After that's done, we're going to come back, and really for about another 20 or 30 minutes, we typically are going to go over the test results, tell you if there's something medically treatable, make those appropriate referrals to an ENT or back to your family physician if that's the case, to set up the next part of that treatment. But remember that about 85% of the patients we see, there isn't a medical treatment for the hearing loss, and we need to talk about a rehabilitative solution, in some instances hearing aids. But we're going to take our time with it, present all the information so that you can make an informed decision about what your next step in the process is going to be. Hearing tests are harmless, they don't take very long, and really there's not a whole lot to be concerned about in terms of physical comfort when you do come in to see us. So if you're having difficulty with your hearing, if you have questions about hearing aids or hearing loss, feel free to give us a call at the number listed on our website, and we look forward to seeing you soon. Thanks.